More than half of the urban dwellers in the developing world live in informal settlements. And our very first speaker brings this reality to us. She is Sohana Samrin Chowdhury. She represents a Bangladesh urban health network. She is head of the urban health unit of Eminence, a Bangladesh NGO, which is at the same time a focal point for the Bangladesh urban health network. Please.
Thank you, Françoise, for introducing me. Hello to all. I know it's the last session today and everyone is quite, I guess, sleepy. So I have decided to show something before the audience before I go into my presentation. So can we have the movie, please?
Bangladesh, a land of 160 million inhabitants on a landmass of 147,500. River erosion, along with other reasons, compel people to move from the rural area to the urban. Every day, around 1,100 new migrants arrive in the city. In the case of this megacity, people opt to eat out rather than at home. Large numbers of migrant women seek employment at ready-made garments. There they work for 12 to 14 hours a day, with the overtime for increased wage. Not having any skill or training, most of the migrated males choose to pull rickshaws as their means of earning. Large portion of the urban population are slum dwellers. People living here can avail very few facilities to fulfill their basic needs. And even to avail such small facilities, they have to go through much hard work. Available. In non-slum urban population, lack of playground in the school campus provides the children with very little or no physical activities. Lures of fast food, cakes and chocolates in low prices develop unhealthy food habits. Urban living environment is a threat to human health, whereas urbanization can and should be beneficial for health. Every citizen has the right to lead a healthy and happy life. Let us make our cities safe and sustainable by accommodating non-communicable diseases in global health agenda.
Thank you. It was actually my way of introducing you to the urban Bangladesh. In forums like this, we always like to talk about the poor, but this is the reality how the urban poor are living in the developing countries in the informal settlements. Now, with the context that you watched right now, this is where well thought out planning and good governances are required. And from the civil society, I will be presenting to you how Bangladesh Urban Health Network, a civil society platform, worked as a pressure group for ensuring health in urban Bangladesh. So while talking about planning and governance, the first thing comes into our mind for urban health is health policy. If we talk about our health policy, it's an interesting story actually. We have been waiting, Bangladeshis have been waiting for 22 years now for a national health policy to be finalized. It all started with the formulation of health policy during 1990s, and it gets formulated and does not get finalized and all. The new government in 2009 firmly expressed its commitments to finalize the policy within 3 months after they take over their place. It came after 3 years, actually, in March 2012, this year. So throughout these years, health in Bangladesh is run by Health, Population and Nutrition Sector Development Program. We are now running the third sector development program. Please note that within these sector development programs, family planning, maternal and neonatal health services, and nutrition are implementation priorities. In my countries, there is also a little confusion that exists in the health sector. Secondary and tertiary level health services are in the hands of Ministry of Health, while primary health care services is the responsibility of Ministry of Local Government. So it's here where the question of coordination comes in. So what are the key challenges that we face in urban Bangladesh? Unfortunately, the newly approved health policy gave no emphasis on urban health issues and strengthening urban health care regulatory system under local government division. There was no indication of how it would be, how it would be worked out, what plans do we need. And institutionally speaking, absence of proper arrangement in the local government division for planning, implementation, monitoring, and evaluation of primary health care through local government institutions is not there. Local government division does not have that capacity. They have their limitation within themselves to undertake large programs in urban primary health care. An equally important challenge is in service delivery, there is somewhat unclear allocation of functions for the two ministries in the existing government document. We call it allocation of functions under the rules of business. And another major gap lies with the insufficient allocation of proper resources of urban health, considering the number of population in urban areas that the programs have to deal with. For example, our urban areas are divided into 4 segments. There are megacity, there are city corporation, then municipality, and other urban areas. The city corporation authority can spend only 12 to 14% of their annual budget for healthcare services. And municipalities, on the other hand, spend still less. And there are now 7 city corporations and 310 municipalities. So you can imagine how these urban populations are getting their services. But still, there are some things that are being done. There is Urban Primary Healthcare Project that is run by the government and funded by Asian Development Bank, DFID, and SIDA. The second Urban Primary Healthcare Project will end soon. And from 1998 to till date, Urban Primary Healthcare Project has only covered 26% of the population they targeted. And there are other programs like Smiling Sun franchise program, NGO run programs. These are actually, they operate in 6 city corporations, in different city corporations, but not necessarily in the municipalities. The Smiling Sun franchise program works in rural health and urban health at the same time. So what is the problem with these programs? Above all, there is the question of sustainability and monitoring. Scaling up, what happens when the programs are over? All these programs are donor-driven. What happens when donors exit? Who will own these programs? So this is where the planning and governance issue comes in, and civil society needs to gather. So in this urban health context, let us see where does civil society stand in Bangladesh. There are 2,104 NGOs working in Bangladesh right now, according to 2012 data. And in the urban health service delivery, these NGOs have a vital role to play. All the major services in urban setting, be it Urban Primary Healthcare Project or the Smiling Sun Project, all are delivered through NGOs like Mary Stopes, BRAC, and others. Also, there are researchers and academicians who are doing small-scale studies to understand the needs of the urban poor. But all these important stakeholders, they do not have any say in policy making, in health policy making, or making any urban health strategy in the country. All the present data and status was pushing the urgent need of a national urban health strategy that would link 2 ministries, Ministry of Health and Ministry of Local Government, and ensure sufficient resource allocation in urban setting, and above all would have clear articulation of how the nation wants to achieve urban health. We will go to the policymakers for formulating national urban health strategy. So finally, in October 2011, the first draft National Urban Health Strategy was shared with stakeholders. And fortunately, Ministry of Health and Ministry of Local Government jointly organized the workshop to share this draft. It was one of the achievements of our network. And we were also able to provide feedback to that draft strategy paper. And the strategy paper is still not finalized. Civil society has their say on that strategy paper from our platform. These are some of our members in Bangladesh Urban Health Network. So this is our future plan. We plan to increase health access, health service access for urban poor in Bangladesh, and we will coordinate between 2 ministries in terms of urban planning and health impacts. So I'll end my speech here. Thank you, everyone, for staying with me.
My first question, while the audience prepares the questions, perhaps, would be to all of you, why is it so difficult to implement?
Like this forum, the interdisciplinary interactions are quite easy, I would say. Like us sitting here, architect and environmentalist, development activist. But when it comes to national level, and when it comes to coordinating between different ministries, what happens in Bangladesh, I will emphasize, like planning ministry and health ministry, environment ministry, if you want to bring them all in under one umbrella, it's really difficult in national level, because it's politics at the end of the day. And policymakers does not, I don't know, also the time is changing now, but still they do not realize that at community level, it's not the ministry that matters, it's not the Director General that matters. It matters like, do I have the road? Do I have the health service I need? Do I have the water I need? So it's about realization that for whom we are working. So I guess when that realization comes in, there will be more coordination.
Thank you. May I now invite you to raise your questions? Please, could you introduce yourself and say where you come from?
Thank you, Josephine van Olmen, Institute of Tropical Medicine in Belgium. I heard and I've seen in New York beautiful examples of how it can be done in cities in high-income countries. But the real problem, as people said, are the mega cities in low-income countries. And I very much agree with the remark of the lady from Bangladesh that it starts with awareness. But to start with something a bit more graspable, are there any concrete, more simple steps or examples that can be taken to start with in developing countries? And are there already positive examples of what has worked in low resource settings in this aspect?
Well, if I consider Mr. Bell's presentation, I was also thinking about, you have identified, very perfectly that if it comes to Dhaka city, to my city, is it possible to redesign the buildings, or, clearing the informal settlements or something like that? Well, but I guess examples can be, from, I have heard from India, probably, the city of Bengaluru. They are trying to, innovate sort of urban planning things with environment in mind, public health in mind. Then there are cities like Pune. They have started, bicycling lanes and awareness program in school children and etc. So I guess if it comes from, the community level, and if there is a certain collaboration between the civil society organization, I mean, all the stakeholders, not only the policymakers. It needs to be, I would emphasize again that it needs to be realized that what is needed right now. So we can take examples from India and some cities of India, and that may work for us as well. Thank you.